Here we're going to go through some range of motion testing of joints. This is starting in our prone position, so laying down. I'm going to test our hip extension. We're going to do both straight leg and then bent at the knee. So from here, I'm just going to grab the shin and the thigh, keep the leg straight and just lift up and see how much I can lift before the hip turns. Same for bent knee. Just like that, before the hip bends. Compared to the other side, remember asymmetry is most important. Very good. Okay, from there I'm going to look at abduction in this extended position too. So I'm just going to straight leg slide the leg away before the QL area turns. And the same in the flex position. See if there's any difference. Same with the opposite. Before the QL area turns, a bit more there. A bit more there, okay. Last one in this prone position for the hip. I'm going to go through internal, external rotations. So I'll look at how far here versus how far here. That's pretty good. Compare it to the other side. Symmetry is more important than perfection. We've got a little bit more restriction this side, a little bit more range of motion this side compared to the other leg. Okay. The other thing we can do in this prone position is our knee. So I'm going to test the quad to see how well she can get heel to hip. Okay, not perfect, but symmetrical, that's more important. Rolling over. Our supine position, I'm going to see how far we got hip flexion mobility. Okay, we're testing our hip extenders. Okay, this is before I see the lumbar flattening into the bed. Okay, that's bent knee. Same again, straight knee. Good. Good. In this position, we're going to now test the internal and external rotations in our flexed hip position. Where in the prone position, we're doing it in extended. So test the internal, external, internal, external. What I'm doing this is I'm trying to keep the femur, the knee straight on top of the hip joint to pivot round. I don't want any adduction or abductions when I'm doing that one. This test is for the hip. This is a really good one for pre-squats. Testing our hip architecture called the Scour test. All I'm doing is I'm sort of pushing and manling with the heel, and I'm just softly holding the knee. But all I'm doing is I'm going to push into flexion and allow her natural hip to go into any external rotation and abduction. So this way I can see where she naturally falls into her squat position and what her hip architecture, the structure, likes to do. I'm not forcing it, I'm just pushing and letting the structure go where it wants to go. That way I can test both the flexion, external rotation, and abduction of the hip. Moving down to the feet and ankles, first thing I'll look at is mobility or range of motion of plantar flexion, dorsiflexion. I'm going to do this both straight leg and bent leg. So if we start bent, I'm going to have it up like so. I'm just going to passively see where she goes to dorsi, see how she goes into plantar. Okay. Not perfect, but the most important thing is we have symmetry from left to right, which we do. So there won't be any talking through the body, any bilateral movements. Okay? Now in the straight leg position, pretty easy. I just anchor it down here like so. Just push into dorsi, push into plantar, push into dorsi, and then push into plantar. Now that's all passive. To test the foot's inversion and eversion mobility, we've sort of look at the subtalar joint here, and that's how I'm going to hold on to it. So I'm going to hold on to each side of the foot like so. I'm going to sit it into neutral position, so it's not in a plantar and it's not into a dorsi, it's in our neutral. And I'm just going to turn this part of the foot with the base of my palms, just to see how well that subtalar joint moves. And when I'm doing this, I'm not pushing into plantar or dorsiflexion, I'm just pivoting on that foot joint.